Good morning, everyone. Thank you so much for being with us here today on Workers' Memorial Day. We're here to remember that worker health and safety is about real lives. It's about people we care about, our loved ones and our community members coming home safe. And it's also a time we recommit ourselves to building systems and policies that protect workers' health, safety, and dignity. My name is Alicia LaFrance, and it's my privilege to introduce the California Labor Lab's investigators that are leading our 3 research projects today. And first, you just heard from Dr. Ed Yelin. I'd like to welcome him. Dr. Ed Yelin has spent over 40 years studying one critical question: how does the way that we work shape our health? His research has given special focus on the newer forms of work emerging today and how those changes are affecting workers' lives. Dr. Yelin is the founding director of the California Labor Lab, and he leads the California Work and Health Survey Research Project, which is tracking exactly these trends. Please welcome Dr. Ed Yelin.
Thank you, Alicia. Everybody can hear me, I assume. So my title of my talk is Protection Gaps in the Modern Labor Market, Evidence from California. So I'm going to provide a little context for the California Labor Lab in general and for our study, the California Work and Health Survey in particular. Many analysts agree that the labor market has undergone profound changes in the ways people are hired to do work. Post-World War II era, in contrast, was characterized by high rates of unionization and traditional work, which meant they had full-time, full-year employment for a single employer with formal hiring and full benefits. The new modes of work, unfortunately, diffuse responsibility for worker welfare to the worker. But some of the signposts of these changes are not unique to this era. There have always been industries that have done seasonal and task or project-based employment. And in California, think both the agricultural industry, which has seasonal employment, and the entertainment industry, which has task and project-based employment. So these modes of employment have existed, but they're coming to be more prominent. So the axis for us in the California Labor Lab for emerging working conditions are really 3. The use of alternative employment arrangements, including independent contracting, on-call work, being employed by a temp agency, and having your work subcontracted out. The use increasingly of contingent forms of employment, which the Bureau of Labor Statistics defined as work which is not going to last beyond the current year. And concomitantly with that, the erosion of workplace benefits and protections that arose in the 20th century, including formal ways of providing workers' voice. So the attack on unionization is part of this strategy. The problem statement for us in the project: what is the full scope of emergent working conditions? And it's not been well known due to measurement issues. A lot of this work we did know is episodic and subject to misclassification, so it's really hard to enumerate. We also wanted to document the impact of these kinds of work on the health and economic well-being of the working age population. It's hard to do on a national basis in the US because of the bifurcation of US data systems. The Bureau of Labor Statistics collects information on the labor market with very little information on health, and the National Center for Health Statistics collects a lot of information on health, but with almost no employment information. So in our survey, we asked not only about the kinds of work that individuals did in their main job, but also in second jobs. And we extended the time frame of the employment questions from the past week to the past month. And as I said, from main to second jobs. Overall, we documented 6% points higher employment over a month than over a week. And then when you look at the different kinds of employment, we increased the yield of independent contractors by 28%, of all forms of alternative work by 35%, of contingent work by 46%, and of app-based work by 42% as well. But the important point here is, although a lot of this work is done episodically and not in the past work, the majority of non-traditional work is performed as a main job. So of the 4.8 million independent contractors in California, 3.1 million of them it's done in their main job. So this is not a college student earning a little money by driving for Uber. These are people's main jobs disproportionately. For other forms of alt work, it's 80%. For app-based work, it's 2/3. And for contingent work, about the same. And this has consequences. Independent contractors, those in the other forms of alternative employment, are more likely to report low earnings, low household income, and poverty level income for their houses. You can see that the left two bars are independent contractors and other alt work. In every case, they're higher than those who aren't in alternative modes. Independent contractors and other alternative workers are more likely to receive TANF benefits, although small numbers these days are able to get TANF benefits. And independent contractors are more likely to receive SNAP benefits. So non-standard work and economic well-being, much non-standard work overall is hiding in second jobs and episodic work, yet most of these non-standard jobs are the respondents' main employment. Substantial numbers of Californians report financial strain. Non-standard employment is associated with lower earnings, poverty level household income, and public benefit recipiency. Turning to health, contingent workers are more likely to report fairer mental or poor mental health, and app-based and contingent workers are much more likely to lack health insurance. Independent contractors and other alternative workers are more likely to have high levels of ergonomic demands on their job, the physical requirements of job, and less likely to have high levels of cognitive demands. And the ergonomic demands are those that have been associated in many studies with subsequent development of occupational mediated musculoskeletal issues. Overall, though, the associations of non-standard work with health are less pronounced than with financial well-being. But many chronic conditions that one studies have very long latency periods, which necessitates looking at risk factors for onset, which is why the ergonomic findings and the different high demands, low control are very essential to understanding the impacts. Non-standard employment is associated with working conditions known to elevate the risk of occupational mediated disease. High levels of ergonomic demands, irregular shifts, and job strain, defined as the combination of high demands and low levels of control, all of which have been associated with musculoskeletal and cardiovascular conditions. So the policy issues. The costs of emergent forms of employment are externalized to workers in terms of economic strain and risks of occupational disease. The public pays for some of these costs in higher rates of public health insurance, ACA subsidies, uncompensated medical care, and other forms of public benefits. Emergent forms of employment are not covered by workers' comp, collective bargaining, employer-based health insurance, and many of OSHA's regulations. Attempts to recapture employment into existing protections for workers by reducing misclassification, for example, AB5, are limited by efforts of the app-based employment companies, for example, Proposition 22. And with that, we'll move on. Thank you.